Within the multidisciplinary team, we've been working alongside different professionals, occupational therapists, physiotherapists, district nurses.
I think paramedics bridge the gap between the acute trust and also the community trust.
We all work together, making sure that the patient gets the right care at the right time, and we learn each other's scope of practice.
I think it provides a truly integrated service.
We've got a much bigger insight into what the team are capable of doing.
I think the really lovely thing about working with both paramedics is they've got a really can-do attitude.
And love the idea of looking at different pathways for patients that doesn't just automatically default to going to hospital. Before we started in the multidisciplinary team, didn't really know sort of what we were capable of dealing with. It's been very useful building the relationships with the teams. Before it was just ringing sort of a centralised number and you didn't really know who you were speaking to and what the outcome was going to be. We go to a lot of urinary tract infections. We've been asked to go out where people have had a fall. Obviously looking at wound care, we've been able to directly access the district nurses to help with sort of superficial wound care.
I think the benefits to the patients are that they get a more responsive service. It reduces the need for them to go through an A&E department, and for the kind of patients that we're working with, that can potentially be a life or death thing.
Paramedics obviously have acute medical knowledge, which we can also tap into. For example, if we go to a patient's home and we feel we might need to get a second opinion from a GP, we can ring the paramedics first and foremost, which hopefully may prevent a hospital admission being made by the GP.
And how did you feel yesterday? I'm just going to pop this on your arm, is that okay? I think the impact that it has on the team is that it's a massive help that we're all working together and all part of that team, all to provide that optimum patient care.
For me, doing the rotational paramedic, it's given me a really interesting insight into different areas of community care. It will give me a different perspective on what community services are available to a patient. Being on A&E all of the time, I've been doing it a long time now, you do get a bit stagnant with it, and this has sort of given me a new motivation.
The good thing about rotation is it takes you away from the mundane 12-hour shift job that I've been doing for 13 years. It's actually given me that motivation.
From speaking to paramedics, the bit that they miss if they leave the organisation is some of the emergency work. But likewise, the ones who are within the organisation feel that they don't get the opportunity to diversify their skills, take the skills elsewhere into other care settings, but also learn from other care settings as well. And that builds stronger relationships. So I think the opportunity to be able to rotate while still remaining within the ambulance service, retaining that identity, I think it is greatly beneficial to us as an organisation, to patients, but ultimately to the health system as well.